we're going to investigate maternal diets and their effects on childhood obesity. Obesity has become of great concern all over the world, with more than 500 million of the world's population recorded as being obese. Much of this concern has been specifically directed towards children. In 2012, 18% of the children ages 6 to 11 were considered obese, and the numbers are predicted to continue growing based off of past trends. In the past 30 years alone, obesity rates in children have more than doubled and quadrupled in adolescents in the United States. Scientists have begun to publish findings that give evidence to this increase in obesity rates is not only linked to the change in children's nutritions, but also their mother's nutritions during pregnancy. Obesity is generally understood as a caloric imbalance resulting in excess body fat that increases risk of other health complications such as cardiovascular diseases, diabetes, stroke, and even types of cancer. The American Journal of Public Health stated that 1 in 5 US deaths is linked to being overweight or obese, so doctors are quick to prescribe a change in diet and more exercise. However, an Australian study in 2008 revealed that the number of children exercising has risen 20% from 1997 alone with obesity rates. With this news, scientists have switched in recent years to try and gain more detailed understanding of the role nutrition plays in obesity, specifically which foods are the major perpetrators and which foods have actually reduced fat mass within children. A study led by Nicholas Harvey from University of Southampton in the UK has tried to come to some conclusions by observing children adiposity or fat mass as a result of maternal diet during late pregnancy. We're going to further discuss this study as we go on, but first, let's talk about how the nutritions are provided to the baby during pregnancy.
There are two main structures that are responsible for providing nutrients to the baby: placenta and umbilical cord. The placenta is an organ attached to the lining of the womb during pregnancy. It is made out of membranes and blood vessels, and it keeps the baby's blood supply separate from the mother's blood supply. Placenta has a blood barrier which is semi-permeable and only allows certain molecules to pass through. The fetus or baby is connected to the placenta via the umbilical cord. The umbilical cord is made up of two arteries which carry blood to the placenta and a vein which returns blood to the baby. When the mother eats food, nutrients such as fat, proteins, and vitamins are broken down and absorbed into mother's blood. Then the bloodstream carries these nutrients to the baby via placenta and umbilical cord. The placenta also protects baby from the attack of certain bacteria and white blood cells. However, keep in mind that alcohol, some drugs, and viruses can pass through the placenta and cause harm to the baby.
As nutrients are absorbed through the mother's blood, specifically the blood plasma, that Dr. Harvey takes a blood sample from each mother at 34 weeks into pregnancy for his research. Studies before Dr. Harvey already provided evidence that a maternal diet during pregnancy affects the body composition of children into adulthood. Such studies have shown that both animals and humans born to obese or diabetic mothers have a higher percentage of body fat that persists into adulthood. However, before Dr. Harvey's study, there were conflicting evidence on the effects of N6 and N3, polyunsaturated fatty acids, commonly known as omega-6 and 3, and no prior studies used measurements for fat that took proportionate body composition into account. Dr. Harvey's longitudinal study followed more than 250 mother-child pairs from birth until age 6, measuring their body composition at ages 4 and 6. His research team found a positive correlation between offspring weight and fat mass with omega-6 concentration in the mother's blood plasma for both ages. The study also found that mothers who consumed higher levels of omega-3 polyunsaturated fats were more likely to have children with more muscle mass, but this gave no evidence related to obesity since there were also a positive correlation with offspring height. Further, there were no correlations with actual fat mass and omega-3, leading Dr. Harvey and his research team to only give definitive answers in concern with omega-6. These findings suggest that exposure to omega-6 would increase the risk of child obesity. Dr. Harvey's results indicate that omega-6 is a major perpetrator behind the rising rates of obesity, considering that maternal diet affects the following generations. This evidence gives clear warning for expecting mothers to steer away from foods heavy with omega-6 and alternatively supplement omega-6 with other long-chain polyunsaturated fatty acids. Even though omega-6 has been correlated with increased body fat in children, it is still an essential fatty acid that the body does not produce on its own and needs for normal development.
Consequences of obesity. There are three major categories for consequences of obesity. Health complications consist of pulmonary diseases, liver diseases. Economical issues include medical bills, reduced work productivity, and restricted activity. Social consequences have stigmatization and poor self-esteem. So, in conclusion, there is a correlation between omega-6 concentration in maternal diet